Hi, this is Michael Peluso from TCM Hub. Part of the things that I do, like most of you, on a daily basis, or at least every other day, we scroll through different Facebook groups that we're members of, and we see what types of discussions are being had, and then we hope that we can use some of those discussions to spur conversation on our own groups or between each other as colleagues. And one of the things that I've noticed over time is the way that questions are often phrased to the groups aren't always the most constructive in terms of helping colleagues help you arrive at the appropriate Chinese medical diagnoses. And so what I've done is I've picked out several examples from various groups, not for the purposes of singling out anyone or being critical in any way, but just picking examples that I think could have been phrased a little bit differently or built upon a little bit more that could help us arrive at a more constructive conclusion in terms of helping that practitioner reach a treatment strategy of some kind. So I want to go through today is an example that I found recently, and I'll show it on the screen here. Has anyone used Yunnan Baiyao for fibroids? What dosage? Any better ideas? Maybe Xiaofu Zhu Yutang or Resolve Lower by Evergreen. Now, these are perfectly acceptable questions, but what's missing overall is a concrete diagnosis of what's causing the uterine fibroid. And so I'm going to cut to a video now that I shot about a year ago explaining the concept of uterine fibroids from within a Chinese medical context. And then if you go back and visit that person's comment, you can see where maybe a few points of clarification may have made that question much more valuable in terms of our ability to help. I hope this helps you as well. So let's look at how TCM gynecology views uterine fibroids. First of all, as you know, a uterine fibroid does not exist in traditional Chinese medicine. There is no disease category known as uterine fibroid. So what do we do as practitioners of Chinese medicine? We do what we always do. We separate the apples from the oranges. While it is interesting to know that there is a diagnosis of uterine fibroid, for us in Chinese medicine, we have very specific criteria for identifying the pattern, identifying the Chinese medical disease, and then moving forward with treatment. So let's look at a few of those. The first step toward diagnosis in Chinese medicine is to reframe the Western disease diagnosis of uterine fibroid into what we commonly see in Chinese medicine as far as symptoms. So Chinese medical diseases, Bianbing, is where we need to begin our process. So very often, the symptoms that a patient presents with that has uterine fibroids are as follows: concretions and conglomerations. Now, these concretions and conglomerations in the context of Chinese medicine must, by definition, be palpable from the outside. What I'm trying to clarify here is that even though we have a Western diagnosis of uterine fibroids, if you can't palpate from the outside of the abdomen, we can't technically make a diagnosis of concretions and conglomerations. So that's one of the limitations of a traditional medicine, but if we're going to be technical about it. Painful menstruation is very common. Profuse menstruation is very common. Infertility, and even frequent urination. As I discussed before, as the fibroid applies pressure to an adjacent tissue, mechanically it may cause a symptom known as frequent urination, which is a disease category in Chinese medicine. So we can add that to our list. So it's important to ask the patient, what signs and symptoms are you presenting, reframe those into the Chinese medical disease category, and then from there we'll begin our process of pattern discrimination. So I'm going to briefly go over some common patterns that are associated with these common disease categories in Chinese medicine. Let's take a look. So if you do palpate a mass from the outside of the abdomen and you diagnose concretions and conglomerations, these often present with blood stasis, qi stagnation, and or phlegm accumulation as their pattern diagnosis. Painful menstruation is usually from qi stagnation, blood stasis, or cold in the uterus. This is a very common one. Profuse menstruation often presents with replete heat, qi vacuity at its root. So if there's excessive bleeding, is what that means. Excessive bleeding is usually caused, if you remember from other videos, the causes of pathological bleeding in Chinese medicine, either qi vacuity not containing the blood, or heat pushing blood outside of its normal pathways. Infertility may have many causes. It's a secondary manifestation of several common Chinese medical disease patterns. Frequent urination, again, this is something that you can look at as a secondary symptom. And when you understand, especially if there's concretions and conglomerations involved, when you break those up, that symptom usually abates.